Hi everyone, welcome back to my YouTube channel. I'm Dr. Yusra Al-Mukhtar. I'm an aesthetic medical practitioner based here in the UK. I have 3 clinics, one in London, one in Liverpool, and one in Manchester. And I'm going to share with you today one of the most frequently asked questions that I get. What supplements do you take? So today I'm going to share with you my absolute go-tos that help me get through my busy day and my crazy life schedule. Now, first and foremost, what I am going to say is there are no supplements that can replace good diet, good nutrition, good sleep. But sometimes when you've got chronic inflammation, you're stressed, you're running around, you're the rushed woman, you're juggling a bit too much like me, I'm going to put my hands up and say I get a little bit of help along the way. And there are some supplements that have been scientifically proven to help improve mitochondrial function, that can help improve cognition, that can help improve sleep, and that can basically just help you to function as your best self. And these become more and more important as we're aging and we're getting closer and closer to the perimenopause, menopausal women, postmenopause, and of course men too. What is really important to understand about the industry is unfortunately it's very poorly regulated. When it comes to nutritional supplements, you can buy anything and everything from Amazon, from eBay, from Holland & Barrett, and not all of them actually have any scientific background. And indeed, there have been some supplements that have been completely debunked as fraudulent. For example, resveratrol. There are no solid, robust data to say that resveratrol is any good. And in fact, the person who claimed that resveratrol was good and made millions and millions off the back of selling it actually was found to be completely fraudulent. And the studies that were published actually never were able to be reproduced. So that is something that I don't take. So I'm going to share with you science-backed supplements that I find very useful and that may be useful to you. But I will caveat, please do have a consultation with a medical professional so that they can help you, guide you, and give you bespoke supplementation advice based on your nutritional needs, your nutritional deficiencies, and of course also on any diagnostic tests that they may do, like a blood test where necessary. Now, how can targeted supplementation help? Well, they can help with skin hydration, they can help with hair loss, they can help with regulating your mood, they can help with regulating your sleep, they can help with improving your skin. So the first thing that I take every single day, which is my non-negotiable, is vitamin D and K2. Well, first of all, I live in the UK where the sun comes out maybe a couple of days a year. We don't get enough of it, and vitamin D is an important vitamin that is needed for not just your bones, but also for hormonal regulation, for mood regulation, and for the function of your body. The other super important thing to know about vitamin D is that it modulates your immune system, and there are now clinical studies that have proven that those patients who take vitamin D on a daily basis and have done for 4 years live longer, live healthier, and have increased length of their telomeres. So this will help you when it comes to longevity, not just short-term mood, bones, and what you think vitamin D is needed for. It's a tried, tested, clinically proven supplement that is important for wellness, and I would say to all of my patients, take this on a daily basis. If you're low on vitamin D, you're very likely to be lethargic, not showing up as your best self, and possibly even suffering with low mood and low sleep quality. Vitamin D, therefore, acts almost like a hormone, not just as a vitamin. And yes, sun exposure is important for the regulation and the actual making, the synthesis of vitamin D. So I supplement this, and also I think everybody in the United Kingdom who is skin of color, particularly in the winter, should be supplementing with vitamin D. How much of it? At least 3,000 international units, or IU, every single day. But here's what's important to know. When you're taking vitamin D, it's important that you're pairing it up with vitamin K2. Vitamin K2 helps the absorption of vitamin D and calcium, ensuring that the calcium that you're eating doesn't deposit in your arteries, but actually deposits in your bones. Vitamin D is an important vitamin for the regulation, the synthesis, and bone turnover. So it helps to actually make your bones solid. In order to get calcium in your bones, you need vitamin D, and in order to get calcium from your diet into your bones, you need vitamin K2 as well. So I take these together as a supplement, and I take it as a spray. The one that I take is the Bare Biology spray. It's 1 spray a day, and it's easy and good to go. And I make sure that I also use this on my children. Number 2, my non-negotiable on a daily basis is the Nuchido Time Plus. Well, essentially, it's a niacin supplement. You might have heard of NAD+. NAD+ is a very important molecule that's present in pretty much every animal animal, every human being, and we all have it, and we make it based on our diet. So we have this as a natural reserve, and we synthesize it within the cells. Now, by the time we hit 20, our NAD plus reserves start to dwindle, and in fact, every 10 years, the amount of NAD plus in our bodies halves. Now, where is NAD plus made, and what is it used for? NAD plus is made within the cell. So every single cell has a cell wall, and then you have cytoplasm, then you have nucleus, and you have a little organelle called the mitochondria. The mitochondria are like the batteries or the engines of the cell. They help the cell do its function. So without an engine to a car, the car isn't going anywhere. And without your mitochondria, there is no life. The mitochondria are tiny but powerful, and they have their own DNA. What they do is they take the NAD plus that is made within the cell, and that NAD plus acts as fuel to help make something called ATP, which essentially is like energy production. It helps to drive the function of the cell. So without NAD plus, without mitochondria, your body isn't going to function. And that means you're going to suffer with cognitive dysfunction, brain fog, graying hair, lethargy, mood dysregulation, sleep dysregulation. And we also know NAD plus has been clinically proven to help reduce biological aging. Biological aging is how well you're aging. And you can actually impact that based on lifestyle and supplementation. So what we know is that as we're aging, there are certain cellular functions that start to become dysregulated as we age. One of the most important things that become dysregulated as we age is mitochondrial dysfunction. This is one of the 12 hallmarks of aging. If your mitochondria are not functioning optimally, like I said, you're going to age faster. And in fact, no mitochondria means no life. Now, your chronological age is different to your biological age. Your chronological age is how many years you've been on Earth. So let's just say that I'm 25 years old. That means I've been around and I've been alive for 25 years. But my cells might be aging faster. I might be stressed, I might be a smoker, I might be drinking loads of alcohol, not sleeping, running around like a headless chicken. Only parts of those are true. And that might mean that my cells are aging faster. So of course, if you're a smoker, if you're a drinker, if you're not sleeping well, if you're stressed all the time, you're going to age faster. Compared to if you're having a good life, you're chilling, you're sleeping well, you're eating well, you're going to age slower. And that is what your biological age is. It's what age are your cells on the inside. And I very much take an inside-out approach to how I treat my patients. I have my ethos, my mission statement on my wall, my clinic, which says radiance on the outside, wellness on the inside. And in order to make you radiant on the outside, you need to start with what you're putting in your body, because what you put in your body is what you're going to put out. And unfortunately, the hallmarks of aging, gut microbiome dysregulation, mitochondrial dysfunction, etc., will result in accelerated aging, and that's going to show on your face. So that's why I take my NAD plus every single day, my NAD plus precursors. And now the important thing to know about NAD plus is that unfortunately, because the scientific evidence is there that taking a precursor can help to reduce biological aging, what people are doing are piggybacking off that, and they are enticing vulnerable patients to come in and spend hundreds on unfounded and unsafe practices like providing NAD plus IV. There is no clinical evidence to suggest taking NAD plus IV where it is not necessary and you're not massively depleted is of benefit. And indeed, there are clinical papers that show that taking NAD plus IV can actually cause harm. It can cause chronic inflammation. Why? Well, because NAD plus is a large molecule. Like I said earlier, it's made inside the cell. So if you're taking it as a large molecule through the systemic circulation intravenously, you are getting a large dose of a very large molecule that cannot penetrate the cell wall. So it's not going to go inside the cell. So you're going to overdose your body with something that you don't need, and that can cause nausea, pain, discomfort, real upset in the regulation of the body. Many people say that they feel very sick when they're having IV NAD+, and it may cause ill harm to your health. So I do not condone the use of IV NAD+, and I would advise stay far away from that. The clinical evidence shows that it's unsafe to do, and it will cause you more harm than good. Now, what about NAD+ or NAD+ precursors taken as a subcutaneous injection? Yes, there is some evidence to suggest that when it's given as a subcutaneous injection, so that means you're just giving it as a little injection in your tummy every day or every other day, that it breaks up into precursors which can enter the cell, and that's where the NAD+ is made. So the small molecules, which are the precursors, can come into the cell and then are assembled within the cell, like Lego pieces are assembled inside the cell and then used by the mitochondria to make ATP production. There is evidence that taking it subcutaneous So as an injection, the NAD plus molecule breaks up into the precursors and is then absorbed into the cell and utilized where needed. The only thing to note about the NAD plus subcutaneous is it's quite expensive. The Nichido currently retails at around £66 for the precursor, and you take 3 a day, and the NAD plus at home retails at about £350 a month. So the price gap is huge, but for those who don't want to take a supplement or an oral supplement, the subcutaneous injection may be more suitable to you. And yes, in my clinic, I provide both. So that's my NAD plus non-negotiable that I take every day. I do take the Nichido Time Plus. Next up, I take pre and probiotics every single day. Essentially, I take live bacteria every day. So as you're aging, one of the 12 hallmarks of aging is gut, oral, and skin dysbiosis. It means that on our bodies and in our bodies, we have billions of bacteria that are living and thriving and help regulate our micro and macro environment. When your good bacteria are thriving, you too are thriving, and the gut-skin axis is real. And indeed, the gut-brain axis is real. That means there are connections that go from your gut to your skin and your gut to your brain. We know this. This is not feeling, this is fact. Now, as you age, the bad bacteria start to thrive, and that results in chronic inflammation. And all of the 12 hallmarks of aging actually are dependent on each other. So if you have lots of bad bacteria in your gut, your oral microbiome is likely to be dysregulated, as is your skin microbiome. One of the ways that you can help to improve your gut health or your gut microbiome is by eating foods that are rich in good bacteria. Things like sauerkraut or kefir or even sourdough bread. But you can also supplement with live cultures of bacteria. They should be no less than 5 billion bacteria. I take the Skin Clear biome. You can also take the Skin Youth biome. There's also AWVI, which I love, which is a skin pre and postbiotic. Now, a prebiotic, almost like food for the good bacteria. So it might be things like garlic or onion. There are certain good bacteria that feed off the food that we eat and that helps them to thrive. That's what a prebiotic is. A probiotic is essentially live cultures of bacteria, and postbiotic is the end product of the bacteria. So these statements are often used interchangeably. I take a pre and probiotic. That means I take the good stuff that feeds the good bacteria, and I take live cultures of bacteria. And there are 2 bacteria that are particularly useful for skin health is lactobacillus and also bifidobacterium. These have been found to help improve the gut-skin relationship. And so I take this every single day as part of my wellness regime. And it becomes very important, particularly for those who've been on antibiotics, those who might have gut dysregulation, skin dysregulation, those who might be prone to acne, or those who might have inflammatory skin conditions like rosacea. You need to make sure that your good bacteria are thriving. Number 4, I take hydrolyzed collagen peptides and a multivitamin. Now, you can take this in various forms. There is a lot of debate about collagen supplementation and if they work or if they don't work. And what we do know is that hydrolyzed collagen peptides, which are basically the broken down little elements of collagen, do help to improve collagen production by optimizing the collagen production pathways. Now, in what doses are they effective? I would say that at the moment, the clinical data is still a little bit debatable, but what we do know is that the way that they are formulated matter, the size of the collagen peptides matter, and also the number matter. I would say to you, if you're going to take a collagen supplement, seek a hydrolyzed collagen peptide and make sure that the supplementation you're taking is no less than 7,500 milligrams of collagen peptides. The 2 that I love are SkinAid and Totally Derma. SkinAid is marine collagen, which actually where the hydrolyzed collagen peptides are extracted from freshwater sea bass, from the scales of freshwater sea bass, and Totally Derma has 10,000 milligrams of hydrolyzed collagen peptides that come from bovine, which is basically from beef. Now, it is halal certified for those of you who are conscious of that. And the Totally Derma is a powder that you can add to a yogurt or a drink, and it's a nice to have, and it's also great if you've got joint dysfunction because it has other ingredients that can help with that. The reason why I like SkinAid is because it comes in a pre-made bottle. I'm generally quite busy. I like to hydrate myself, so I use it as my hydrator and I down my other supplements using the SkinAid. So for me, it's just productivity stacking. It's easy, and when it's easy, you're more likely to do it and you're more likely to be compliant. It's low calories, only 35 calories, and because it's a pre-made drink, I'm not faffing around. I keep it in the fridge, I take it out and I drink it, and it tastes great. But also, it's not just collagen peptides, because collagen alone is kind of useless. You cannot make collagen if you don't have vitamin C. Now, the beauty of SkinAid is that that particular product has got 450% of your recommended daily allowance of vitamin C. So why so high? Because you need 100% of your recommended daily allowance of vitamin C just to maintain the collagen you have. If you want to make new collagen, you need 350% of your recommended daily allowance to make new collagen. And you can't make collagen without vitamin C. So it's needed in order to make collagen. So the fact that this comes with vitamin C means I'm optimizing my body in that collagen synthesis pathway. It also has omega-3, which has an anti-inflammatory profile, and that comes from organic flaxseed oil. And it also has L-lysine. What's L-lysine? It's an essential amino acid. And here's the thing, guys, there are essential things that you should be taking in your diet, like, for example, essential amino acids, essential fatty acids. These help to improve brain health, cognitive function, skin health, and are important for just life, for making collagen, for making skin. Remember, collagen is not just there for you to look good. It's important to help with wound healing, cell differentiation, cell communication, and more. So that's why I like to take a multivitamin that has everything in it, and the Skin Aid has that. It also has MSM, which is a natural organic sulfur, and this helps to downregulate inflammation. So it's a great added ingredient for patients who might have chronic inflammation. And it has vitamin B as well. My patients who take it tell me that they start to notice that their nails are growing faster, their skin is brighter, their acne clears up better, and their hair thickness is better as well. So that's one of my go-tos that I take on a daily basis. Next up, I take an omega-3 supplement every single day that's high in EPA and DHA. We easily get omega-6 in our diet, but we don't get omega-3 very easily in our diet. You can get it from fatty fish. So I would say to you, try and eat salmon, haddock, mackerel, anchovies, which are really dense in omega-3. Oily fish is a great source of omega-3, as is flaxseed. But if you're not getting that from your diet, do consider supplementing. It can help with cardiovascular health, can also help to maintain cognitive function, and it can help with maintaining the skin lipid barrier. For me, I take one that is high purity, that's high in EPA and high in DHA, and I take the omega-3 Arta complex, which you can see here. And lastly, I also take Viviscal Professional. It's a supplement that has been clinically proven to help improve hair growth, and not just hair growth, but actually hair thickness. Now, Viviscal make a range of different hair supplements. They also make shampoos and conditioners. I take the Viviscal Professional, not the Viviscal Maximum Strength, which you can find in Boots. Maximum Strength is, I think, quite misleading because it makes it sound like it's quite strong, but actually it's the Professional that is much, much stronger. And it's also the one which has got science-backed evidence. There was a randomized controlled trial that looked at Viviscal Professional, and they found that those patients taking it had an increase in hair density by 12%, hair diameter thickness, and also the number of hairs, the number of terminal hairs. So people were growing more hair as well. The thing to understand when taking this particular supplement is that it might not just grow the hair on your scalp, but it can also grow hair elsewhere. But if hair loss is a concern for you, or you want to prevent hair loss, or you start to notice post-baby hair shedding or thinning with aging, then it is a supplement that you might wish to consider. Having had 3 children, this is something that I started after I noticed hair shedding postpartum, and I take it periodically to help maintain my hair density. The important thing to know, you need to take 2 a day, and you need to take it for at least 6 months to see a difference. Now, the science behind Viviscal Professional, apart from the randomized control trial, is that they have a patented molecule called amino Mar-C complex. This is a marine protein complex that helps to prolong the anagen phase, which is the hair growth phase, and that's how it helps to improve hair growth. They've got a protein complex, they've also got zinc, biotin, and iron. Now, there is no evidence that taking biotin gummies will help your hair at all, whatsoever. So if you do have hair loss, please, first and foremost, do see a medical professional, get your bloods done to check if you have any deficiencies, check your hormonal health, and check if there is a reason, a source for hair loss. Never ignore hair loss, because prolonged hair loss will just get worse, and the trajectory of hair loss can be quite upsetting for people. Men and women can get hair loss. Androgenetic alopecia affects at least 50% of the population, both men and females, by the time they hit 50. And the thing with hair loss is that once you lose hair, the follicles become tighter and tighter and tighter until they can become sclerosed, or the hair thickness can become really quite thin. And then that means your hair can take much longer to recover when you start an intervention. There are lots of things that you can do about hair loss. The important thing is to start as soon as you notice it and nip it in the bud. If you leave it too long, treatments become a lot less predictable. But if you start to notice it and take action quickly, you can nip it in the bud, you can improve your hair growth, and you can reduce hair shedding as well. I've done a whole podcast and YouTube video on hair loss, and it's something that I'm really passionate about because I see people coming into the clinic much too late. We can help them with a range of different treatments that we offer in clinic. So if you're suffering, please do get in touch and we can help you with hair loss, diagnosis, assessment, genetic testing to see why you're losing hair, blood test to assess for any underlying conditions, and then treat you as needed. So last but not least, my absolute everyday non-negotiable is magnesium. I take magnesium L-threonate. This has actually been clinically proven to pass the blood-brain barrier. It can help to improve cognitive function, which means you show up as your best self, you're able to make decisions better with more clarity, with less brain fog, and also it's been shown to help improve sleep. Now there are a range of different magnesium supplements that you can take. Another one is magnesium glycinate or bisglycinate that can help particularly with sleep, modulating your sleep and improving sleep, which you would take in the evening. But you can take magnesium L-threonate both in the morning and in the evening. And this is my non-negotiable and has helped me just manage my life, sleep better, think better, and show up stronger, more confident, more competent on a daily basis. So there you go. Those are the supplements that I take that help me age gracefully, that help me get through my day list, that help me to function optimally, and that give me radiance on the outside and wellness on the inside. Thank you for watching. If you have any questions, please drop them below and contact us for a consultation. If you want the list of supplements that I've curated, you can find these on the website www.skinhub.co.uk. You'll see all of the supplements that I have outlined, and the link is also down below. Till next time, bye.